So with me is Dr. Jeroen Bax. Dr. Bax is currently Professor of Cardiology at Leiden University Medical Center, and Sir is also the President for European Society of Cardiology. So Dr. Bax, welcome to India and CSI TV studio. So a lot of patients in your practice you would have seen comes complaining of chest pain. So how do we evaluate these patients? What is the risk and what should be the investigating modalities to tackle these patients?
I think as clinical cardiologists, we see a lot of patients presenting with chest discomfort. So the first question you ask yourself before you do anything is, what is the pre-test, before any test is done, likelihood of coronary artery disease? And so if that pre-test likelihood is very low, and we take a cutoff of 15%, we don't do anything.
Okay.
The likelihood that he has coronary disease is very low, so we do lifestyle modification. If the likelihood is very high, we take a cutoff of 85%. We send the patient directly to angiography. The likelihood that he has significant coronary artery disease is very high, and he needs probably revascularization. It's the patients in the intermediate pretest likelihood, which is between 15 and 85%, where we do a test. If it is lower intermediate likelihood, which is 15 to 50%, 50, then we do a CT scan because we want to include or exclude atherosclerosis of the coronary arteries. If it is intermediate higher, which is 15 to 85 pretest likelihood, then we do a nuclear scan or we do a stress echo, and we do that because we assume the patient will have coronary artery disease, but we want to know if he has ischemia. So based on the pretest likelihood, we can probably treat well the patient. Your question is going to be probably, how do we determine
the likelihood? True, because that's going to be for physicians across the country, they should understand the likelihood. Based on that, they will approach the patient. True.
That is the key question. Of course, everything is relative, but we have at the European Society of Cardiology a guideline on stable coronary artery disease management, and there is a simple, very simple pretest likelihood calculator that comes from literature and it was put together by this guidelines team.
Okay.
So what does this calculator include? It includes your age, it includes the gender, and it includes the type of complaints. And based on those three, you calculate the pretest likelihood.
This calculator will give us a percentage?
It gives you the percentage, and based on that you can apply what I just said.